see that development and to impact long-term health outcomes. And maternal environment, though, as I mentioned, the placenta has a major male factor to it. So that effect from the father's sperm continues throughout the pregnancy in the way that the placenta remains healthy or not. And I think one of the things I've noticed, certainly when it comes to clinical practice, is that the importance of placental health is often overlooked in pregnancy, not by obstetricians and gynecologists, they get it, but often women are not aware of just how to look after your placenta so that it can best support your growing baby. And so I find that fascinating. But so I would say for the father, it's preconception. For the mother, it's preconception and during pregnancy, of course, the exposures that she's kind of creating in her for the baby whilst it's developing.
And if we're thinking about that 90-day period, which, as you mentioned, it's quite nice that it's a similar period for both mother and father in terms of things that could affect egg health and sperm health. Are the things that would encourage and promote good sperm health the same as egg health, or are there differences?
There's slight variations. So the first one that jumps to mind is the heat exposure. So, there's a reason why the scrotum is outside the body, and that's because testes are very sensitive to heat. And if you're someone who exposes yourself to hot baths, sauna, actually, perhaps you're putting your laptop on your lap in front of the television in the evening, pretty short term, like 20 minutes of high heat exposure can have an immeasurable impact on sperm structure and like the way basically sperm count as well for the next sort of 90 days. So actually, depending on the level of exposure, quite a lot of the men I've worked with are very worried about sauna because sauna is good for you, right? But if you're trying to conceive, and especially if you're a very regular sauna user, the time it can take for sperm to recover fully is up to 3 months, 4 months. So you have to really think about reducing that exposure if you're going to try to conceive. Or if you are trying to conceive and you realize it's not working so well for you, the heat exposure is something to look at. Similarly with very, very tight underwear. So I always think about cyclists here who wear tight padded shorts and then there's a lot of heat there. One of my patient couples had been trying to conceive for a while, and I then asked about the partner, and he cycled something like insane amounts of miles every day, every week. Sorry, and I said, okay, we need him to just change that and then try again. And actually, sure enough, they had other changes, of course, but it helped. And they were able to get pregnant. So it's really nice to think of those 90 days as where, in terms of pregnancy, that's when you really are working together. So male heat exposure is unique to men for the sperm quality. And then some of the nutrients, micronutrients, are associated with better parameters for sperm is slightly different to eggs. So zinc is super well known to be essential for sperm motility. And so that's an important micronutrient to be aware of for men. Omega-3 fatty acids are extremely important for the sperm structure. So making sure that men have those, oily fish, algal supplementation, walnuts and flaxseed and chia seed in their diet. And then for women, which is less kind of an impactful thing for men, it's things like iron status. Making sure that you have a good iron status before you try to conceive is a good idea. For egg quality itself, we've discussed the fact that it's longer term exposure. So here we're really thinking about how do you help your body to select the best possible egg and have successful ovulation. So making sure you're actually eating enough food. The body perceives undernutrition as a signal not to ovulate. So making sure you're eating enough. And in terms of like the actual micronutrients, folate is top of the list. So, folate status is crucial for the first trimester and really for the first 8 weeks. Many women don't know they're pregnant in the first 8 weeks. And that's why prenatal supplementation is always recommended. And the folate status is important for the egg quality itself. So those are kind of the differentiators. But I think actually overall, the same dietary pattern is applied for the couples. So it's the Mediterranean dietary pattern is the best research when it comes to fertility outcomes and actually pregnancy outcomes. So the review I authored was on the Mediterranean diet for pregnancy outcomes. And we know that it ticks all the boxes. It has the omega-3 fatty acids, it has zinc, it has adequate folate from leafy greens, it hits lots of micronutrients, adequate iron status, and overall adequate food intake, reduction of alcohol. That another massive one actually that's worth noting is if you want to decrease DNA fragmentation, don't drink alcohol. It's a teratogenic, carcinogenic, neurotoxin. So like just cut it out altogether for those 90 days, and certainly throughout pregnancy. And same with smoking. Smoking is massively problematic for sperm and egg quality, and of course for pregnancy outcomes. But I do believe that now smoking during pregnancy has really gone down a lot, which is good.
I know you mentioned there that prenatal supplement is usually recommended, if not always, for women that are pregnant. But if we're focusing on that preconception period and the mother to be and father to be are eating a healthy Mediterranean diet, do you also recommend supplementing with some type of multi during that period as well? Or does it depend on the specifics of that individual diet? How would someone go about that?
In an ideal world, people could have their micronutrient status assessed, and then they could have targeted supplementation for any gaps. That's like gold standard. For most people, public health recommendations are certain to supplement with folic acid. So that is, regardless of how healthy your diet is, like a folic acid, folate supplementation is important for the mother. In men, there is not a recommended prenatal for everybody. So it would be very much based on your diet, your lifestyle, and potentially your age or how long you've been trying to conceive, as well as ideally micronutrient status. So there's different supplements you would recommend based on the patient data, on the history of that patient and of that couple, to be able to say, actually, okay, let's try and tweak this, let's try and increase this. I think where a lot of prenatal supplements fall short now is that they have so many things in them. And there's some nutrients that we've touched on today: choline, iodine, folate, iron, right, zinc, that have strong evidence that they are helpful, but then there's many that don't. so it's like, even sometimes I'm surprised to see that people can be quite vocal about how much of an effect certain supplements can have, but then the data doesn't really stack up against it. So some of these supplements have over 12, 15, 20 different micronutrients. And more is not more with supplementation. It doesn't necessarily mean it's going to be helpful. Another one is, I would say, omega-3. I think many people don't get enough omega-3 in their diets. And certainly if you're following a plant-based or vegan diet, then being mindful of getting omega-3 from an algal supplement at this time would be helpful.
When it comes to sperm count, you and I had some emails going back and forth. And I think people will have heard the kind of commonly cited figure that there's been a 50% decline in, I think, total sperm concentration over the past 5 decades. And certainly I've heard that a lot. There seems to be some mixed reports on that. How do you kind of reconcile the various data that's out there, and how would you summarize how sperm count has changed, if at all, in men over recent decades?
If you look at the global data, sperm count has declined. The issue, I think, is some people frame that as a decline in fertility. And fertility hasn't declined by 50%. It's some of these analyses have seen sperm count decline. Now, when you look at specific populations, actually, as we discussed on email, some of them haven't had this 50% decline. So there is definitely a signal from the global data that there has been a decline in sperm count. And I think we should take that signal seriously and ask ourselves, like, why could that be happening? What has changed? A lot has changed in our environment, our lifestyle, and our diet that may have contributed to that. But what does that actually mean for humans? I think we need to be mindful that fecundity and fertility are impacted by a lot of other things. So like whether people choose to have children full stop because of other factors. The way I reconcile the data is to think about the global signal as a signal, as an interesting data point that we should be aware of. But then when speaking to groups or individuals, how relevant is that to them? So for me, the 50% decline in sperm count is more of a call to arms to better understand our environment and our reproductive health for the future, sort of a global level, and not just researchers, but also policymakers and people who think about the future, essentially. But I don't think it should be too alarming for the individual, because there are different studies that show that in some populations this is not the case. And we have to be mindful of how sperm is collected, how the metrics have changed over time. So like how the WHO defines low sperm count has changed. So actually, it's one of those classic examples of quite hard to pin down exactly what this data means. And, Simon, we've discussed that even just having a hot bath can change your sperm. So how do you reconcile like when these sperm were collected, these these donor samples, and then they were measured, and what the populations were, how old were they, how frequently had they ejaculated previously, could the sperm count have been affected by their sexual, like their sexual function in the past week? So there's lots of factors at play, but the fact that there is this trend is definitely a signal that I think, most scientists have definitely been like, okay, there's something going on here. Now, alongside this drop in sperm count, of course, we are seeing a decline in the number of children people are having. So, but I think where the mistake can sometimes happen is to blame the sperm count decline, or that calling that the reason why fertility has gone down. It's not the only factor, and it's not applicable to everybody. So we just have to be a bit mindful not to do that correlation thing where we're like, well, that's changed over there, so it must be the answer to this. It's not as simple as that.
And what I'm hearing as well is that, yes, maybe sperm count has gone down. Maybe we don't fully understand it, but we do understand that things like a healthy Mediterranean diet, focusing on specific nutrients, not overdoing it in sauna or hot baths, that those types of lifestyle changes will make significant changes to the quality of sperm count and also function, shape, how they're swimming, DNA fragmentation, all those things.
Exactly. So it goes back to a lot of free things that you can do, right? So not smoking, not drinking, getting enough sleep, exercising, making sure that you are actually be not too sedentary. These lifestyle pillars that we know of and that are such powerful levers for chronic health, for chronic disease, and for long-term health also offer a great way to improve our reproductive health. So what I also love about this topic is that everything that helps us with our reproductive health actually helps us full stop. So the two things marry up so nicely. And of course, there are specific things to think about that we've touched on. But overall, if you're going to be engaging with these changes in lifestyle and diet, you're going to be supporting your long-term health anyway. So it's worth doing regardless of how soon or whether you want to eventually procreate. They're worth engaging in it as behavior changes.
I'm going to ask
we
you a
haven't
loaded
touched,
question.
Simon, on... Oh, go on, tell me.
Within that Mediterranean diet,
Yes.
is there room for soy foods, for tofu or soy milk? And I guess what would you say specifically